Good afternoon, everyone. My name is Kristen Wayner, and on behalf of Teleflex, I want to thank you for joining us for the second of a two-part series of webinars focusing on Vessel Health and Preservation Initiative. Following our presentation, we welcome your questions. Please submit them throughout this session from the questions section of your GoToWebinar control panel. This webinar is accredited for 1 contact hour for nurses and respiratory therapists. The title of today's webinar is Vessel Health and Preservation, How to Implement the Right Approach for Your Patients. Speaking on this very important topic is Ms. Nancy Moreau, CEO of PIC Excellence. Ms. Moreau is a highly sought-after speaker on peripherally inserted central catheters and issues of vascular access practice. Ms. Moreau began her nursing practice in 1981 and is currently part of the PIC IV team at Greenville Memorial Hospital in Greenville, South Carolina. She provides educational consulting, program development, and speakers bureaus in conjunction with PIC Excellence. She is continuously involved with research and literature analysis and shares her expert opinion on PIC lines, ultrasound, and vascular access with manufacturers, hospitals, and individuals throughout the U.S. and abroad. Ms. Moreau has disclosed the following. She is part of the Speakers Bureau for Arrow, Teleflex, Cook, Excelsior, and 3M, and educational support from Access Scientific, Angiodynamics, and Genentech. At the end of this webinar, you can obtain 1 contact hour by going to www.saxtesting.com/VH, where you can complete the post-test and evaluation form. Upon successful submission, you will be able to print out your certificate of completion. The provider, Sax Communications, is approved by the California Board of Registered Nursing Provider Number 14477. This program has been approved for 1 contact hour of CRCE by the AARC, and all of this information will be emailed to you 1 hour after the conclusion of this webinar. No off-label use of products will be discussed. Ms. Moreau did not disclose any conflicts of interest in relation to this presentation. And now I turn it over to Ms. Moreau.
Welcome, everyone. I'm Nancy Moreau, and it's my pleasure to be here with you today talking about vessel health and preservation, how to implement the right approach for your patients. Our objectives for today are to discuss vessel health and preservation, the model and components. We'll review the evidence that supports the initiative towards vessel health and describe the specific steps to implement the process of the right line for the right patient at the right time, creating an optimal situation for patients' vessel health and preservation. So what is the right approach? How do we create a culture of safety for our patients, one that really provides a safeguard so that good things happen to them? In order for us to do that, we need to put forth some effort, provide education, and have the willingness to embrace concepts that really do ensure the best outcomes for our patients. Vessel health and preservation is a concept that was created to promote patient safety. Vessel health and preservation is a process that requires us to think in a new way, a way that focuses on application of best practices, a way that creates opportunities for education for clinicians, doctors and nurses and respiratory therapists, pharmacists, and all others, that helps us to establish a better understanding of the culture of safety and how we can do it. Vessel health and preservation applies an early assessment process for the patient that helps to facilitate early initiation of treatment with a vascular access device. Through a specific system and process, vessel health and preservation applies daily assessment forms and tools that help to establish goals for the patient and to assess those goals with a multidisciplinary focus on the right device for the right patient at the right time, and helps to make sure that we assess each patient every day for device necessity. With vessel health and preservation, we're able to apply constant evaluation, making sure that we're doing the best that we can for our patients, and also making sure that the bedside staff have a clear understanding of assessment principles, those that should be applied not only every day, but also every shift in the process of providing the best care for their patients. The implementation process for vessel health and preservation is not a one-day or a two-day process. It's a process of applying a new paradigm, a culture of safety, as you will. The Joint Commission considers a process like vessel health and preservation one of the patient safety solutions, those that help to promote patient safety. Vessel health and preservation applies evidence with guidelines and recommendations systematically, reduces patient and organizational risks, help to sustain best practices not only through nursing but also through the application with a multidisciplinary focus of involving all the disciplines in the process of creating the best scenario for the patient with vascular access. It helps to establish new lines of communication between the various disciplines and changes the culture by helping us all to be patient-focused on specific goals for vascular access. So when we talk about the process of the right line for the right patient at the right time, this is just a thought process that helps us to recognize that specific to vascular access, there really is a right line for the patient. And while it's difficult to establish standardized processes for selection of the right line, each patient comes with a particular set of processes, diagnosis, and other types of critical or non-critical conditions, chronic conditions, that help us to select a device that really is best suited for them. The right line involves a process of education for all staff. The vascular access staff is already fairly well educated and has a good understanding about device selection, but vascular access experts are not the only ones that are involved and aren't the only ones that should be taught about selection. That really should come from the time the patient hits the door of an acute care center or any care center where infusion therapy will be provided. The right line selection includes assessment with all types of treatment considerations so that duration and the treatment process can be considered and applied to the specific device. Communication should be enhanced in order to establish the right line so that we're all in agreement that this is the best for the patient, and that communication should involve not only all clinicians but also involve the patient. When selecting the right patient with the right line, we must take into account those risk factors that are particular to the patient, particular to the challenges that we may face in inserting a specific device, and how to do it in a timely manner. Patients come into the hospital, and if there are delays in establishing a device, or if we're just trying to establish one device after another in dealing with a crisis, that doesn't allow the patient to receive the treatment process in the best way and the one that will promote healing in the best manner. Patient factors must be taken into account and involve the patient in order to ensure safety. Assessment is key to making sure that the patient is safeguarded throughout their length of stay and even after. The right time for the right line and the right patient involves those assessment factors that ensure that the device is still needed or not, or that we even have the right device. Taking the lines out as soon as the treatment process is done is something where much education is still needed. In working in my facility, we find that frequently devices are maintained for multiple days, even after medications are no longer given intravenously. And it requires multiple clinicians to be aware of the need to assess, the need to do this on a daily basis in order to remind us to pay attention that a device is no longer needed and should be removed. Creating the opportunity to apply the right approach is part of creating a culture of safety that ensures the best outcomes for our patients. Integration of vessel health and preservation system is a process and a protocol that starts with the patient being admitted to the hospital. This protocol can be incorporated into your own hospital systems as a protocol that is automatically applied depending upon how you process that protocol through medical staff and the approval processes. But even without a completely approved protocol, vessel health and preservation can be applied and implemented in the process that you see here, where assessment is done within 24 to 48 hours of the patient admission, an assessment specific to vascular access. Vessel health and preservation is initiated by using an assessment tool and by implementing the process of the daily assessment throughout the course of the patient's stay. The device is inserted in a timely manner and then assessed each day for necessity, assessed for complications and whether the device is still the most appropriate. Once the device is no longer needed, that device is removed and the patient is typically ready for discharge. All of these processes should be considered as a dynamic cycle in order to consider your own medical facility and how it can be customized to best suit your population. The evaluation process helps you to look back and evaluate each stage of vessel health and preservation in order to ensure optimal application and implementation. We all are aware of best practices and all challenged to apply them well. How do you currently apply best practices? Think about the various guidelines and recommendations and how they may be applied in your facility. Are they consistently done? Are all aspects of the Centers for Disease Control guidelines and recommendations applied in your facility? Are there any methods for measuring compliance? When we're talking specifically about vessel health and preservation, and you think back on the rights that we've just discussed, do you have a process to apply those rights now? Maybe you're already incorporating many of the concepts of vessel health and preservation into your own facility with early assessment and other types of assessment processes. By incorporating all of these best practices with early assessment, timely selection and placement, multidisciplinary daily rounds and goals with determination or necessity of the device, and then designated education frequently throughout the whole process with evaluation mixed in. That's how we come up with the best results for our patients specific to vascular access. With the daily assessment process, we've talked about how you apply a daily assessment tool in order to apply the right line for the right patient at the right time in determining whether there have been complications, whether the device is the best for the treatment. Is the device still comfortable for the patient, and are they involved in the process of assessment? Does the device still accommodate the treatment plan, or have there been interruptions that might lead you to consider that this is not the best device? All of this is incorporated into the right time, and is the device still needed? Many times devices are placed, specifically central venous catheters or PICCs, at the time of discharge in order for the patient to have prolonged treatment at home. Consideration for insertion of a PICC line or other device should be done early in the patient's stay and not late, not only to apply economic principles, but also to make sure that the patient has use of this device and has the least amount of trauma. We're all aware of many of these processes as the ideal that we want to do. But how do we actually apply them and integrate them into our processes? And how do we help the rest of the staff be aware of the things that we're looking for in order to determine things like device necessity, such as can the medications the patient's receiving intravenously be changed to oral? And is this something that we look at every day? All of these processes help us get to our end goal or our end result, which is the best outcomes and the least interruption of the treatment plan so that the patient can heal and get home as soon as possible. The evidence that supports vessel health and preservation is quite lengthy, and there's a reference list at the end of this presentation. But there are many outcomes specific to vessel health and preservation that are integral to the evidence and guidelines that we currently have. The Registered Nurses Association of Ontario has evidence-based practice recommendations specific to assessment and device selection for vascular access. They incorporate some of the key concepts of the right line for the right patient at the right time, including choosing the best vascular access device based on the treatment plan, focusing on the least number of lumens and the smallest size, also selecting the safest site for the patient based on bacterial load in an area or veins that are available, the risk that may be associated with specific devices either for insertion or during the dwell of the device. Also incorporation of ultrasound for all central venous catheter insertions. Many of these guidelines that you see in recommendations here are all integrated into the Registered Nurses Association of Ontario's guidelines and recommendations. And many of these you're already aware of and things that we've just discussed. Here's a list of the guidelines and recommendations that were included as part of the Vessel Health and Preservation Program. Included here you can see the Centers for Disease Control, the Society for Healthcare Epidemiology of America, the Institute for Healthcare Improvement, the European Society for Parenteral and Enteral Nutrition, the American Society for Diagnostic and Interventional Nephrology, the Registered Nurses Association of Ontario, Joint Commission, and the Agency for Healthcare Research and Quality, and the EPIC guidelines from the United Kingdom, as well as the Oncology Nurses Society. All of these associations and groups have published documentation on recommendations specific to vascular access. Many of them, such as the Oncology Nurses Society, have guidelines for vascular access that are quite current and provide lots of details in order to help guide us in the development of policies and procedures and education. These were references that were incorporated into the entire process of vessel health and preservation in order to make your application of best practices an easier, smoother, and more consistent process. Specific articles also help to provide education and description of best practices and guidelines and the process for using the vascular access devices. Many of them you can see here. The list of articles and expert information that was used in conjunction with the vessel health and preservation was quite lengthy, and you can request a copy of all the evidence at any point in time simply by contacting your representative, Teleflex, or contacting me. Here's another list that simply shows the supporting guidelines for vessel health, for early assessment, for daily goals, for incorporation of education and application of a vascular access team, as well as multidisciplinary collaboration. I encourage you to access these articles and reference materials so that you're familiar with the processes, especially as you go out and do more and more education. So evidence helps us to establish the opportunity and framework for our patients to have better outcomes. Vessel health and preservation promotes better communication, and studies show that when nurse-physician collaboration and collaboration with other clinicians is effective, it can actually increase the quality of care, improve not only communication and understanding, but also coordination of care, decrease patient morbidity and mortality, increase patient satisfaction, and also increase job satisfaction and retention for all of us who are involved in the patient care. Now, all of this that I've discussed up to this point is background information, a bit of review, and then the evidence supporting. Now let's get down to the details of how we actually implement vessel health and preservation. Looking at the steps towards implementation of vessel health and preservation, evidence has demonstrated a reason for us to move toward change. Why is vessel health and preservation needed? Because the evidence shows that by applying processes such as this, we're able to reduce rates of infection, such as with central line-associated bloodstream infection. We're able to reduce delays in device insertion, delays in infusion of medication and applying the treatment plan. We're able to reduce phlebitis rates and other negative outcomes. Patient satisfaction is increased, staff satisfaction is increased, and workflow blockages are reduced. And so by using these types of processes and applying them in your hospital, we're able to have many positive outcomes. So how can you apply vessel health and preservation? How can you implement the process in your facility if this is something that interests you, something that you feel would be valuable for your patients? The first step is to develop a proposal. Begin with a proposal that helps you to show that vessel health and preservation is a performance improvement project and one that you can apply with patients within your medical facility that helps to promote better outcomes. The focus is on better clinician communication and improved patient satisfaction as part of your objectives, all specific to intravenous access and infusions. As you develop your proposal, think about the performance improvement initiative and what you're trying to do. Focus on these goals. Understand that this type of proposal helps to qualify for magnet projects and one that many individuals in the hospital may be interested in helping you support. If you need help with the development of the proposal or in doing a presentation to help to see if you can garner some interest in vessel health and preservation, the support is available. Clinical staff can actually come and do some presentations for you, and I do go and do vessel health and preservation presentations on a regular basis. And so this is not something that you have to do by yourself. But more than that, it should be a team-wide concept, one where you gain support through various individuals in your hospital. The individuals that you need to look at include people such as your risk management officers, those that are involved in risk management and in the quality. The Chief Quality Officer is frequently looking out for projects that will improve outcomes and improve patient satisfaction. Being involved in helping to talk with your central line-associated bloodstream infection committee can help you to also garner support in order to move forward with this type of proposal to your hospital. And so working together to establish various individuals that help support your proposal, help you in the development, and then in the presentation of your proposal will help you to achieve success. So where do you start? Well, after your proposal is created, you need to go and gain support from senior management. Presenting your proposal, presenting the information on vessel health and preservation, touting it as a performance improvement project and one that will also reduce infections. Establish a designated nursing leader and physician champion to work with you. Again, this needs to be a team project and not one that we do individually in order to gain the greatest degree of success. Your infection preventionists, your risk management, your chief quality officer, and other medical directors may be interested in working with you on this project and helping to establish the implementation team. The team itself will look at key areas that should be covered in order to begin the vessel health and preservation implementation within one particular unit area. Work with your nursing unit directors in order to find out who is most interested in doing a performance improvement initiative of this type. You want a group that is enthusiastic and committed to success in implementing vessel health and preservation. Once you receive the go-ahead from senior management that yes, that they're supportive of this project, that this is something that they want to do and are willing to invest time and effort into doing, then you're ready to move forward, because at that point the team typically will fall into place. The individuals who offered you suggestions or helped you to review your proposal initially are those who are most likely to give you support and work with you on your implementation team. Consider this team an interdisciplinary council and make sure that you have individuals from multiple disciplines who are involved in the process. Physicians, nurses, even pharmacists, respiratory therapists, and others who are specifically involved with vascular access and committed to patient safety all may want to be involved. And so establish your implementation team with key individuals who are committed to working together to make this a success. Your goals of your team specifically are to establish your implementation plan, create the plan for how you're going to implement this unit by unit, and how you're going to implement the whole process. Have your team members elect which sections that they would like to lead, which sections of vessel health and preservation that they are most interested in and want to head up, because it is a big concept and one that needs to be done section by section. Determine the frequency of the meetings that you'll have with your implementation team in order for you to meet the goals of your plan, in order for you to step through the planning process. And then work to keep the momentum going. Try and keep the enthusiasm up as you're able to reach the milestones of your plan, as you're able to move forward, looking for successes, looking for ways to celebrate improvement as you start to work within the particular units. So with vessel health and preservation, you've identified your processes, you've identified how you're going to implement the tools within the hospital and work on the documentation. The individual unit staff will be involved in the educational process that helps to understand application of the tools and how that aids in documentation and adds to the patient medical record. As you work to customize the whole process of vessel health and preservation with your hospital, you'll be working with particular individuals very likely on modifying the tools in order to fit within whatever electronic medical record you may already have. The customization process is all part of how you want to make it the most successful and work within the culture that you already have within your hospital. Planning phases for implementation is part of your implementation team goals and processes. You'll designate the unit, work within the unit to provide the education, work with the managers of the unit and the team, and then over time measure compliance with the tools in order for you to see how successful they are being with the implementation of each section of the tool process. Overall, be flexible. Help all the team to understand what your goals are and how you want to achieve them. Be the cheerleader for the unit that's implementing the process and help them to understand how they're promoting patient safety and how they'll be helping the rest of the hospital by customizing things before it goes hospital-wide. Anticipate a variety of cultural changes, from the medical staff to the nursing staff to pharmacy and others, as you implement this process. You may hit bumps in the road. Be flexible enough to address those bumps and look for solutions, even creative solutions. The entire process of vessel health and preservation will take approximately 6 months to a year to implement as a full process, depending upon your hospital, your situation, and really how well you implement step by step. As you identify processes for integration of your tools, you'll look at your current hospital processes and things that you want to improve. How device assessment is done now, talking about these issues with your implementation team. Your team will look over how documentation is done, what electronic medical records are involved now, how physicians do progress reporting, how nurses do their vascular access assessment now, and then how the tools specific to vessel health and preservation will be integrated into the whole process. Consider how the unit staff can optimally use the tools. And when we talk about tools, we're really only talking about 2 or 3 tools that you'll be implementing over time. But those tools are crucial to doing your early assessment, to doing daily assessment and goals analysis in order to make sure that the patient is moving forward in a process with the best outcomes. Looking to how the staff use the tools over time helps you to have an awareness of whether they are invested in compliance, whether they want to complete the tools, how they can complete the tools easier and better. If there are things that you need to add or delete from the tools in order to smooth the process for the staff, and then working together with your implementation team to gain information, communicate with those who are doing the processes so you get valuable feedback that helps you with the refining process. Planning the process of vessel health and preservation seems to work best in a phased-in process. If you're able to split implementation into 3 or 4 phases, it may make it easier to bite off each section and apply them well in a way that will be easiest for the hospital unit to do without a whole lot of disruption of services. You don't want to overwhelm the nursing or medical staff with too many changes at one time. And so with phase 1, it seems to work best to start the daily assessment tool first. Implement it in one unit. Focus on communication and collaboration specifically with nurses and physicians, integrating the patient as well. Working through the evaluation tools that help to gain patient feedback and clinician feedback. They'll tell you through the evaluation tools how well they're doing, how valuable they feel the tool is, and whether there needs to be any changes. Once you reach 100% compliance with the daily assessment tool, then you're able to easily move into phase 2. When you have the 100% compliance, or whatever level of compliance you choose to move forward with, then you know the staff is comfortable with the process and values the information that they're receiving. With phase 2, you continue the daily assessment while working on customization and transferring it into an electronic form that works best for the staff. You then begin using the admission assessment tool for each new patient that comes into the unit. Specific to new patients, the bedside staff may do the assessment, Or in your hospital, you may decide that there are others that take responsibility for doing the assessment tool. Whichever way you choose to do it, trial it, test it, see which way is best for your institution. Customization is a must in order for you to get the most out of vessel health and preservation for your facility and for your patients. Fine-tuning is integral to the whole process and helps you to move into phase 3. Be flexible throughout and commit the time that it takes in order to reach success. Step through the process and know that you can add another month if necessary in order for the staff to continue trialing a particular form. You can go back and change the processes. Concentrate on reaching good compliance with each and every phase. Have your implementation team meet regularly to discuss the challenges and creative solutions that you may be able to reach, remembering the goals of vessel health and preservation. It's not about the technical process of just completing a tool. It's about why we're doing it and what end result we're looking for. Better patient satisfaction, fewer devices used, and most specifically using the particular device that is specific for that patient and their needs. You should see improvement with central line-associated bloodstream infections and seeing your rate drop. Patient satisfaction should increase, not only because they're getting more attention through the discussions and evaluation, but also because they feel like that you are valuing the device that's placed and that you're not traumatizing them unnecessarily. With less devices used and fewer complications, overall the patient will become more satisfied, and you as a staff member should feel a certain sense of gratification knowing that things are working better for everyone. Be sure and broadcast your successes. Celebrate those points that you move through, each of your steps that you're able to go through with your milestones. Help the entire staff to be aware of this project that you're doing in this one unit. And pat the staff on the back in that unit, helping them to understand that they're helping everyone. Communication can be done through your newsletters, through posters or abstracts at conventions, showing the steps that you've gone through in order to make improvements with patient safety. So with vessel health and preservation, how do we put it all together for implementation? The system goals that are specific to vessel health and preservation include that each patient will have the best vascular access device inserted in the most timely and appropriate manner. Early initiation of the most appropriate vascular access device will have the best outcomes and the fewest devices, so that ideally one device lasts throughout the patient's length of stay. Other goals are that they'll have reduced risk from insertion, not only through applying guidelines such as the central line bundle in the insertion practices, but also in care and maintenance, improved education to the staff. As you move through each of the phases, you'll be implementing the education at various times, helping the staff to be more and more aware of those best practices that result in better outcomes for the patient. Those best practices and education are something that we should be doing throughout our year working with staff, working together. We know through research that each time education is implemented, that we have reductions of infection, that we have improvements of outcome. And so that evidence is very clear that education alone will make improvements. And so this vessel health and preservation implementation process gives you the opportunity to implement education throughout. Putting it all together for the patient incorporates various tools such as the daily assessment tool, the early assessment patient admission process, and then the order set and other processes that help with the education of the staff, and then the evaluation tools that allow you to get feedback on the use of the primary two tools in order to incorporate them best into your hospital structure. Establishing an intentional process for assessment, device selection, daily assessment of the correct device, determination of necessity and function, all will help to improve patient satisfaction and help to facilitate discharge with the best outcomes and completion of the treatment plan. The key concepts with vessel health and preservation are why we're doing this. The implementation process for vessel health and preservation helps to perform all of these key concepts and functions: enhancing communication, improving selection and assessment with vascular access, really helping staff to understand the importance of vascular access and the role that it plays in helping the patient to get better and move towards discharge. It allows us to apply our guidelines and recommendations in order to be compliant with the central line bundle, to apply the central line checklist, to truly evaluate each device at least daily for device necessity, which is part of the central line bundle compliance, and then overall enhancing patient safety through application of this protocol. You can see on the left-hand side, as the patient moves from admission through their stay, that these are the goals that we're looking for in order to have all of these best outcomes for the patient until the point of discharge. Implementing vessel health and preservation involves a process of your evaluation of the gaps at your hospital, those things that you want to improve, the things that you feel that are necessary to ensure safety for your patients. It helps us to move into application of vessel health and preservation with selection of a unit and starting vessel health and preservation, even if you just start in a small way and then choose to step through it over time. It allows us to provide education for inserters and unit bedside staff, helping to organize and really coordinate improvements in communication that help to facilitate better patient outcomes. Implementing all the tools into a process within one unit helps you to bite off smaller portions and to show your success in a small way before you roll it out hospital-wide. Communicating with all the staff and helping them to understand why it is important to do vessel health and preservation, what value it has for the staff and for the patient, is also integral to success of the overall program. And then each step of the way, work with your implementation team to reevaluate the steps that you've taken, the successes that you've had, and also the challenges, so that you can make improvements with each phase and each step in your implementation process. This cycle will help to ensure your success as you consider vessel health and preservation for the betterment of your patients. What is the total value of vessel health and preservation, and why should a hospital even consider it? Vessel health and preservation will help to facilitate a faster decision process for device selection, which will speed the patient to discharge. It should ensure a shorter time to infusion and treatment, compliance with the bundle aspects that are necessary for our Joint Commission reviews and other accreditation reviewing bodies. It produces fewer delays and accesses per patient, which helps the patient to feel more comfortable and trusting in the whole hospital system. Daily device necessity determination is part of the process, which most hospitals are missing now or don't have a specific way in order to document. It helps to apply assessment and promote multidisciplinary communication that we know through research results in better outcomes. The overall evaluation of improvement and preservation of veins is part of what we want to do for patients in order to make improvements in our healthcare system overall. And then the education that's provided throughout will help everyone have a better understanding of best practices and allow us to meet some of our other goals, such as reaching zero for our infection rate. So the question that I have to ask you is, what are your next steps? What is your decision in applying and implementing vessel health and preservation? Is this something that you feel would be valuable to your medical facility? And how can you be integral in making this all happen? Here are some of the references that we have that show support, and as I said, there's much more information and documentation supporting vessel health and preservation. I am glad to be available to provide more information to you and support as needed. I also recommend that you contact your local sales representative in order to gain some of the printed materials that they already have available free of charge. Thank you for your attention with this program, and thank you for the opportunity to speak with you about implementing vessel health and preservation.
Thank you. And we will move into our question and answer session. Before that, I just want to review the continuing education credits. And again, this information will be emailed to you 1 hour after the webinar, so don't feel like you need to scribble it all down. To obtain one contact hour, go to www.saxtesting.com/VH, where you can complete a post-test and evaluation form, and your certificate of completion will be issued immediately. The provider is approved by the California Board of Registered Nursing, provider number 14477. This program has been approved for one contact hour of CRCE by the AARC for respiratory therapists. And Ms. Moreau, we do have a number of questions from the audience, so let's just jump in with the first one. Is there a genetic set of tools available for us to examine as a model to customize?
Yes, there is a sample set of tools that's available in order to help you to look at the process and apply it in your facility. The admission assessment tool that I showed the brief picture of, as well as the daily assessment form and all of the other evaluation tools are available to you. All you have to do is request them. The easiest way to request them is to go through your sales representative, but you can also go through myself or Nancy Trick or others in order to receive those tools and the whole process.
Terrific. And the next question, how would you practically educate the staff by the psychomotor method and make the process second nature?
Well, I think the process of educating the staff first begins with helping them to understand the goals that we have for vessel health and preservation. In terms of the psychomotor education, that is part of the process. As you may have determined by applying it in phases, the process in phases, you start using a tool and then you go back and look and see how they are actually completing the forms, how that integrates with the documentation process, and then gain feedback from them on how they feel it can work better. You go through the process not only with the clinical staff and evaluation, but also with the patient and some of the questions that they may have been asked by the clinical staff, and ask them how it's working for them. Overall, you analyze the process, the psychomotor process of how they understand, do it, and improve it throughout the use of each of the forms. By doing it in phases, that gives you the opportunity to do these actual measurements in order to make improvements.
Okay, and our next question from the audience. Are we required to follow or adopt the CDC guidelines?
Well, that's a good question. What is our responsibility in adopting the Centers for Disease Control recommendations? There is not a requirement. When you think about the difference between standards, guidelines, and recommendations, standards are the strongest legal document and one that you can be held accountable to in a court of law. But we also find that evidence-based guidelines and recommendations can also be held up to you in a court of law. And so while there is no mandatory or complete requirement to apply all of the Centers for Disease Control recommendations, there is a responsibility that we apply evidence-based practices within our hospitals. And when you have a document as strong as the Centers for Disease Control, I can say that you do have some liability to apply those recommendations within the workings of your facility. And if you don't, then there should be some sort of reason behind it. If you don't have the ability to incorporate ultrasound as part of the insertion process with the central venous catheters or PICC lines, then you would need to have some reasoning behind that, because the evidence is so strong that it creates a liability risk for you. So when you don't apply guidelines and recommendations, then you are legally responsible. You do run the risk of creating a situation where you may be more liable. Also, you may have noticed now, while Joint Commission is not the accrediting body with all hospitals, Joint Commission is a good example of an organization that looked at the Centers for Disease Control guidelines, or recommendations specifically, and incorporated them into their requirements within their national patient safety goals. And so the question that I would ask you is, what's the requirement for applying the national patient safety goals? And as I said, in many of them you'll see the recommendations from CDC. And while I recognize that that's not a real direct answer, I hope that that was complete enough to deal with that question.
Thank you. We have a few more questions as time permits. Will Vessel Health implementation reduce our CLABSI rate?
Specific to infections, I talked about the use of education as an evidence-based tool to reduce infections. And so, specific to education, implementation of vessel health and preservation in and of itself will help to reduce infections. You'll be able to do retrospective and prospective evaluations in order to determine the change, but vessel health and preservation as an implementation process will have an impact on infections. A positive impact.
Our next question, what are the most tangible benefits to C-suite administration of the Vessel Health and Preservation Program?
Your biggest benefit to your administrators and the C-suite, as is commonly termed, is in improving patient satisfaction. We're seeing a change to pay for performance, and one that will impact the pocketbooks of hospitals. That pay for performance is specifically tied in to patient satisfaction surveys that are done. Vessel health and preservation has already been shown in some small models to improve patient satisfaction and to have an impact on those end results for our administration. Administrators are also keen to help reduce infection in any way that they can, especially implementing in a process that really doesn't cost any more money. So instead of using a new product or buying a new device or things in order to improve your infection rate, this is a performance improvement protocol that can be implemented within the staff yourselves and help to improve infection rates and other outcomes. Complications cost money, and your administrators are certainly keen to help to reduce complications overall, and specifically infections.
How do I convince my hospital administration to take on a project like VHP?
That's the trick, isn't it? If you're excited and interested in doing vessel health and preservation, I'm sure that you're thinking, gosh, how can I do this? How can I convince my administrators? How can I gain enough support with this project to move forward? And really, it's just knowing that you want to do it, being committed to it, and starting to talk about it that will help you to move forward. Create that proposal that I talked about in the presentation. Show that proposal to many people and get them to give you feedback, suggestions on how you can improve it. Get a lot of feedback and create a strong proposal, and then go and do a full-on presentation for your administrative staff and get them to think about the concepts and to choose whether or not they want you to move forward with it and work with the implementation team. That's my best recommendation.
And a somewhat related question, how can I as one person implement this program?
Well, again, it's not about doing it by yourself. It's about getting buy-in from other people, even at the earliest stages of developing your proposal. This needs to be a team concept and one that is not just focused on one person. Don't let everyone look to you to do all the tools and do all the implementation. That is not a prescription for success. Success with vessel health and preservation is through a team moving forward on the implementation. And so work together, get that support, get administration to buy in, and have key people in the implementation team so that you can truly know that you will be successful and move towards your final goals.
The next question is, I love the forms, but what really is the best form to start with? And can you tell me a little more about the how?
So when you look at vessel health and preservation overall, it can be a bit overwhelming. There's just one place to start with vessel health and preservation, and I think that that's best done with the daily assessment tool. Going through the daily assessment goals, making sure that their communication is established early on between nurses and physicians and the patients in order to evaluate those vascular access devices that are already there. Start them in the process. Start the education and work with that daily assessment tool in order to gain the support that you need from the staff and move forward. But again, one of the keys to success is to start small. Work with one unit, work with one tool, and start moving forward slowly. Use that daily assessment form as your hook to get everyone on board with the overall process.
Okay, thank you. And I think we're just about out of time. So if we can advance the slide, we can do a quick wrap-up. And again, I want to thank everyone for your attention in this webinar. And this session by Nancy Moreau has been recorded and will be archived at vesselhealth.org in 7 to 10 days. And for more information on vessel health and preservation, check out that same website. So again, a big thank you to all of our attendees and to Ms. Nancy Moreau, and I wish everyone a good day.